I'm Dr. Ngozichukwu Nneka Unaogu. I'm the medical director of Federal Neuropsychiatric Hospital. Enugu. I am also a psychiatrist. The experience has been the same because I've been in psychiatric practice for a long time, about 2 decades now. And it's been quite rewarding. We manage every form of mental illness here, being a specialist hospital and a referral center. We are able to handle most of the cases that come to us with good results, good recovery rates, and in good time too for the patients. Because we have enough professionals, mental health professionals that handle these cases. Psychiatrists, psychiatric nurses, clinical psychologists, social workers, occupational therapists, and other support staff. So our patients are exposed to holistic care. We also have visiting physicians that handle the physical problems of our patients, the medical problems of our patients. So the experience has been quite rewarding, though, like you find in most settings, finances is a challenge, especially for the patients. Some of the patients are brought here and their relations are not able to pay for treatment and they abandon them and they become the responsibility of the hospital, liabilities to the hospital. Sometimes we finish treating the patient gets well, and we can't even find the relations to come and pick them. So we have to repatriate to their communities. And sometimes we get to their community and the relations may even refuse to accept them. So we have some of them here, but most of them are treated and they go home and they come for their follow-up care. We also have outpatient clinics where they are attended to after discharge. So we do both inpatient care and outpatient care. There are many causes. I cannot say this is one cause. So I usually group them into the biological, psychological, and social factors that could cause mental illness. For the biological, you're talking about the genetics, the genes inherited, the traits inherited from the person. Someone may come from a family where you have people that have had mental illness before. You may see another person from the same family coming down with the same kind of mental illness. So it's biological, it's genetic. Some people have the genetic vulnerability, but they don't come down with the illness. So the fact that you've had a relation that has a mental illness, it does not translate that you or every other person will have the illness. That's why we say there are other factors that also act on that genetic vulnerability to influence the onset of illness. We talk about the psychological factors, how the person is made, how the person responds to things around him, how you perceive things around him. Then the social factors, things in the environment that could trigger the onset of illness. We have the economic factors, social factors, religious factors, several things. Like now, because of the economic situation of the country, you see that many people are coming down with different forms of mental illnesses and all that. So the economy too can contribute to the onset of some illnesses. it starts with self-care behaviors, like having a good sleep, eating balanced diet, engaging in relaxing activities, connecting to people around you, networking with people. It helps with mental health, networking with people around you. Then remaining hopeful. You know that now we have a renewed hope agenda of Mr. President. Then engage in creative activities. It helps the mental health. Then supporting others and seeking support when you need support from others. It also helps mental health and helps you prevent you going down with some mental illnesses. Like discussing your problems with people instead of keeping it to yourself and all that. Mindful practices like meditation, yoga, all these things help us. Then improving the sense of self-efficacy. That's the I can do spirit. I can do it. You go for it. So, or you're allowing others to do what you think they should be able to do instead of interfering with you. It also helps their mental health. Staying away from unprescribed medications and psychoactive substances. So drugs that act on the brain to influence the mood, the perception, the thought processes of the person. So, and forming good relationships, the mental health, digital detox. Okay. There are times we have to move away from all these devices and you just do nothing. You keep away from your phones, your computer, tablets, gadgets, just to detox from away from some social media things. You know there's many toxic things now on the internet. So you do a digital detox for yourself from time to time to clear your head. It also helps your mental health. The main challenge is finance. The federal government is trying. In fact, in recent time, the past 2 years, the federal government has put a lot into healthcare because of the president's renewed hope ahead. A lot of money is now being spent on health institutions, especially since after the COVID-19. But still, like Oliver Twist, we ask for more. Because the money spent on power now, that's energy, power supply, electricity, is very high. So it takes a large chunk of the money that comes to the hospital, paying for this band aid and maintaining services. So that is one. Then two, this issue of patients coming in, being abandoned is a challenge for us because it also drains our resources. You have to feed patients, you have to give medications to make them remain stable, they occupy the bed that they are not paying for. So maybe is finance that's is a problem. There are many things we would have loved to do, but we are being limited by resources. But we are trying to improve this, definitely, from what we are getting. The World Mental Health Day will be commemorated on 10th October 2025, which is Friday this week. And the Federal Neuropsychiatric Hospital, Enugu, is also going to be part of the celebration. On 10th, Friday 10th of October, we are going to the correctional center, Enugu Correctional Center, to have an outreach. We have a lot of mentally ill people there, both in the inmates and in the asylum. Many of them are not getting care, the needed care. Though this hospital already has an understanding with the correctional center, we sent doctors there to see once a week to see the mentally ill people there. This time around, we are going there to celebrate the day with them. So there's going to be free consultations, medications. We are also going to give them some personal care items like soaps, towels, slippers, toothpaste, toothbrush, just to identify with those ill, mentally ill amongst them. So that's 10th. We are also going to have the mental health awareness walk the following day, which is Saturday, 11th. Also marking the day, we are going to have an awareness walk in Enugu. The start-off point will be this hospital and we return. So we are going to go through the whole of New Heaven, Ogui Road, Presidential Road, that street, and back to the hospital, creating awareness and also distributing information leaflets to people concerning the day and how to promote good mental health. So those are our activities for this thing. At the correctional center, we are going to give a health talk. We have also been having some talks on invitation by some organizations. We did as FIRS yesterday. We are also going to the 82D headquarters to give a health talk on Friday 10th to the Nigerian Army Officers' Wives Association and Nigeria Army Soldiers' Wives Association. We are also going to give a mental health talk there, an awareness campaign there. So those are our activities for the mental health day. This outreach is actually planned for the correctional center. So if you're not within the correctional center that day, you're not likely to benefit. But people that have mental health issues are still free to come to the hospital and we will see them. We will not. The hospital also attends to people without mental illness. So it's not just mental illness we treat here. We have a general outpatient department where all kinds of illnesses are seen. We have medical officers there, and we have a clinic where we see other people that are not mentally ill. So you're free to walk into the psychiatric hospital and get care. It's located close to the gate, so you don't have any contact with the inpatients.